Good afternoon, everyone. Hope you are all staying safe and well. Just want to thank you all again for taking the time to be here with us today, because if you are here, it is because you believe that healthcare is a human right, and/or you believe healthcare is a human right and you want to learn how it is that we can get there, whether again, it is at the federal level, but also here locally within the state of Rhode Island. So today I'm going to talk about some state legislation that myself and Senator Sam Bell are sponsoring within the state house. And in addition to that, also talk about how it is that we are going to pass this legislation, ensure that we have a state budget that reflects the needs of working people, and ultimately have a Medicare-for-all single-payer healthcare system here in Rhode Island. So going on to the first slide, I want to talk really quickly about the model. Because right now, as I had mentioned, we have legislation that would essentially create the Rhode Island Comprehensive Health Insurance Program, otherwise known as RICHIP. And what RICHIP would essentially do is act as the single insurer for people across the state. And in doing so, people would have the coverage of having their prescription drugs, medical check-ins and visits, dentist visits, and vision services free of cost without the worry of any requirements regarding deductibles, anything regarding premiums, and in addition to that, some of the typical out-of-pocket expenses that forces working people to not seek the coverage that they need. Because I do want to note, here in Rhode Island, we have relatively high private health insurance coverage. However, disproportionate to other states, our populations, well over 40% in fact, of people in the state are underinsured. And what underinsured means is that someone has health insurance, however, they don't seek medical care because of how expensive out-of-pocket costs are. And this is exactly what we're going to address. However, I do want to note that in addition to passing this piece of legislation that would create the RICHIP program, we have to work on making sure that we have a sustainable funding stream. And as we have noted before with the previous speakers, the United States spends more on healthcare than virtually every other country, yet our outcomes are lower. And one of the reasons for that is because of the wasted allocations that we make to the private health insurance industry and the administrative costs that come with that. Instead of being able to provide direct care, we're often seeing all the complex and complicated paperwork and bureaucracy that is taking place at the providers and within our government as well. So to ensure that we're actually having the funds that are necessary to pay for this Medicare-for-all RICHIP program here in Rhode Island, we're going to take what is mandated and allowed for under the ACA, the pre-existing federal reimbursements that we receive through our Medicaid and Medicare services, and essentially pump those funds into the RICHIP program. And I'm going to break that down in the next slide in terms of how that is going to be possible. And again, I said it before, this is going to be a 2 to 3 year process because it would require us to adjust our state budget and then apply for a waiver from the federal government, essentially telling the federal government, hey, all of the federal reimbursement money you give us for Medicare and Medicaid, we're now going to transfer those funds into the single payer healthcare program that we have here in our state. So again, it's all going to be dependent on the investment that we as a state government are willing to make into our Medicaid and Medicare reimbursements. And in addition to that, also making sure that we're cutting out a lot of the unnecessary expenses as it relates to the Office of the Health Insurance Commissioner, as it relates to the reimbursements that we give out over to Health Source RI and all the other middlemen that currently exist that simply act as a barrier for people to actually get the healthcare coverage that they need. And again, I want to be very clear, our state government has control over this. We have a $13 billion plus state budget, and it saddens me to share that oftentimes we are seeing Medicare and Medicaid go untouched or sometimes even cut, while having corporate welfare programs continue to increase each and every single year because of the corporate influence that does exist through lobbyists and other influential politicians. So next, I'm going to highlight the specific ways that we can adjust our state budget and make sure that we have the federal and state funds possible to administer a single payer healthcare system here in our state. So going on to the next slide, first and foremost, we have to repeal all of the Medicaid cuts that happened under Governor Gina Raimondo. While it is not widely known, under Governor Gina Raimondo, we cut Medicaid each and every single year, and we cut it well over into the hundreds of millions of dollars. In addition to that, we simply have not kept up with our reimbursement rates. As I had noted before, when it comes to different services that are available, we, especially dental, for example, we haven't updated our Medicaid rates and Medicare reimbursement rates since the 1990s. Yet and still, we're continuing to see the cost of healthcare increase while not actually keeping up with the cost in terms of what we're willing to do as a state to make those investments. So in addition to that, we're also going to have to focus on deprivatizing our current Medicaid system here in the state. Again, not widely known, but compared to other states across the country, we hire private contractors and managed care organizations to help manage our Medicaid system. So we don't actually have the in-house expertise at this given moment to administer this single payer healthcare system, which again is why I've noted that this is going to be a 2 to 3 year process, because we're going to have to get rid of all these private contractors and instead within the Department of Health have the work and that is necessary within the Medicaid office to make sure that we have the experience and expertise to run our statewide Medicare-for-all program. In addition to that, that's going to be eliminating managed care organizations, otherwise known as MCOs, from our Medicaid program. And I want to note that this has already been done in other states, most notably Connecticut, which passed this piece of legislation and deprivatized their Medicaid system about a year and a half ago. In addition to that, I want to be conscious that when we increase Medicaid rates, we're increasing rates for those providers. We're making sure that at the same time, we are creating economic and job opportunities for our healthcare workers. It is no secret that we are currently in a healthcare worker crisis, and a lot of that has to do with the fact that we lack the state investments necessary to keep our health workers here in the state. Instead, we see reimbursement rates be generally higher in Massachusetts and Connecticut, where again, understandably so, healthcare workers have chosen to take their talents over there, especially during the COVID-19 pandemic. And then beyond that, we also need to be as creative as possible and conscious as possible about making sure that we're doing other direct investments for the purpose of workforce training. And some of that has looked like exploring what does it look like for the University of Rhode Island, URI, to have a medical school. Because aside from that, we currently just have Brown University's medical school, which as we know, unfortunately, is private school, private institution, and his very deep ties with Care New England and Lifespan, which are very much focused on the current for-profit insurance program that we have in place. So going on to the next slide, I want to address, again, some of the frequently asked questions about this Medicare-for-all program. I want to be very clear to everyone that this program would not get rid of expensive health insurance companies. They would still exist and would allow for wealthier people if they chose to continue enrolling in private health insurance programs. However, they would not be allowed to charge patients more than the RICHIP reimbursement rates that we are going to set within the piece of legislation that we have forward. And because of that, there are going to be other tight restrictions within the for-profit health insurance companies. So it is likely that they will threaten Rhode Island and say that we will essentially divest from the state and go elsewhere. However, as we know, oftentimes for-profit corporations tend to say that anytime there's legislation that will impact their profits. And in practice, it usually does not happen. In addition to that, I also want to mention that our current healthcare providers would not be impacted. So again, we have a public health insurance, but would still have private providers. So that is essentially going to remain the same. Instead, our providers are going to have more freedom because they're not going to have to be so stressed out about the bureaucracy and administrative paperwork that they currently have to do based on our for-profit insurance system that exists. And in addition to that, also just want to note that, again, we can do this here at the state level and do not have to wait for the federal government to act. I know a notable example of states that have tried Medicare for all is most notably Vermont. Vermont tried to establish a Medicare for all healthcare system back in 2012. However, they failed to do so because of the fact that they didn't have their financing in order. As I mentioned before, the only way we're going to get to a sustainable Medicare for all healthcare system here in our state is if our state budget moving forward looks different and actually makes the investments necessary for Medicaid and Medicare. Vermont did not do that. They kept their traditional reimbursement rates, which were not high enough. So when they applied for the waiver from the federal government to have their expenses shift to a single payer healthcare system, the math simply did not add up, and the federal government was not willing to provide them with that waiver. And then as a result of that, they also explored the option of income taxes, essentially putting the taxation back on working people, which was politically unpopular as well. And again, the plan that we have established would put us in a position where the reimbursement rates would be at the levels necessary to get the federal waiver and also get additional federal support to make it happen. So now that I've essentially explained the legislation, I want to tell us all how it is that we are going to get there. Because you are here on a Sunday afternoon, because you are passionate, because you want to advocate for this program to ensure that each and every single Rhode Islander has the healthcare that they deserve. And I want to be clear that the forces we are up against are very powerful. They are corporate interests and they are political interests. And that's why it's not going to be easy. At the same time, we also have a media that's unfriendly to the idea that the state government can do more to help support working people when it comes to healthcare needs. But this is why, going into the next slide, we're going to see what it is that we can do, and that is legislative advocacy. That is making sure that when it comes time for the committee hearings that are happening both in the House and Senate Finance Committee, that we are turning people out to show up and make it known to our state representatives and our state senators that this is plausible. We have the research, we have the numbers, and we have the information necessary to be able to establish this program. And we have people in the state who recognize the need for a program like this. Again, I want to emphasize, people in Rhode Island, yes, they have health insurance, but they're not able to access it. So what exactly is the point if you're paying a monthly premium, but you can't even afford to go to the doctor in the first place? So with that being said, we are going to ask, after this speaking event, that you all sign on to a community piece of testimony that we have prepared and will be delivering to Senate and House Finance Committee members, and having signatures from people across the state is going to speak volumes. In addition to that, also want to be absolutely clear that it is important that you also reach out to your state representative and your state senator and have a conversation with them about what single payer Medicare for all here in Rhode Island would look like. Because oftentimes, I have a lot of my colleagues who will sign on to the bill because they want to tell their constituents, hey, I support Medicare for all, I support healthcare for you. But they're not always necessarily advocating for it. Instead, it's simply just their signature on the piece of paper saying they're a co-sponsor. So it's up to us as the constituencies to make it clear that, hey, you're not just going to sign your name on the paper and say you support Medicare for all on paper, but instead you are going to act on it. You are going to actively advocate for it, educate your other colleagues, and make sure that this is a priority going into every legislative session. And going on beyond that, also wanted to add that in the next slide, what we're doing right now is unprecedented. What we are doing right now has never happened in the state of Rhode Island. We have never had informative town halls like this, where we are able to speak with members of the community and inform them why Medicare for all is possible and the path and the vision on how we're going to get there. So I believe that with this grassroots organizing that we have delivered here today and will continue to deliver across the state, we're going to build a momentum that is absolutely necessary for next year's state budget and even this year's state budget to be more reflective of the healthcare needs of our people. That being increased Medicaid reimbursement rates, increased Medicare reimbursement rates, thus putting us in a position where next year, when we come back to the table and we continue introducing the bill, we will continue to have the advocacy that is necessary and the finances necessary to make it happen. So with all of that being said, I want to thank you all again for taking the time to be here. And my last question for each and every single one of you is simply the next slide as stated, if you will join our movement to ensure that we have a Medicare for all system here in Rhode Island. Thank you.